North Carolina's Health and Human Services Secretary writes an open letter warning of potential cuts for millions of North Carolinians and cuts to providers with looming Medicaid cuts.
News 13's Kimberly King is live in Hendersonville, where she talked with the director of the free clinic that is located there. Kim, what can you tell us?
Tammy, the state's health secretary cited potential cuts that could go into effect by October 1st could include programs like hospice. But the political debate is at the center of this issue, and it is how much should the government provide? Pauline Carpenter is executive director of free clinics in Hendersonville.
Even some of our folks that are insured, they can't afford some of their medications like Ozempic, different things like that we provide here for free.
Ozempic, the weight loss drug on the list the state's Medicaid program could end. The deeper question around federal health care is how much should the government provide for low-income residents?
No one should have to walk around and have a chronic disease that's untreated.
Isn't that socialized medicine?
Basically, but it's access to care too.
And is that what's at risk in your opinion?
Yes.
This month, the state's health secretary writing North Carolina's elected state reps and senators a 4-page letter warning of federal cuts, forcing NCDHHS to cut $319 million from Medicaid by implementing rate reductions of 3% across all providers and elimination of certain services. It is impossible to fill the funding gap without making reductions to acute care hospitals, nursing homes. NCDHHS will end optional coverage of GLP-1 drugs for obesity, which affects more than 1 in 3 North Carolinians, potentially reducing costly chronic-related conditions like diabetes and heart disease. On top of medical cuts, the director of the area's medical society says we worry about families having to choose between housing, food, and care, and hope the cuts don't cause hospitals to close. A UNC study states Angel Hospital in Franklin and Blue Ridge Hospital in Spruce Pine may both be at risk. The state's healthcare association says Trump's big beautiful bill could cut up to $50 billion in Medicaid funding to the state over the next decade. The free clinic is already seeing increases.
We had an uptick after the hurricane. Since January, we have seen over 200 new neighbors come through our door.
Doors open to anyone in need. The concern now, how exponentially will the need for free care grow? The free clinic site opened more than 20 years ago. It depends on grants and donations from the community. Now, Republicans have spoken out saying that the threats from the secretary are pushing back. They say they're calling for more fiscal prudency when it comes to the health care budget. Reporting live from Hendersonville, Kimberly King, News 13.